Myeloma is a disease of the older patients, so I think it's very important that we take the age and the comorbidities that come with it into account when you think about the treatment, for a variety of different reasons. One, a lot of these patients have other comorbidities. They may have diabetes, they may have high blood pressure, and especially these ones are irrelevant from the standpoint of the typical type of drugs we use. So many of the drugs that we use in myeloma can give peripheral neuropathy. So if somebody has underlying diabetic neuropathy, that needs to be taken into account. Some of the drugs can have adverse effect on the heart. So people with existing hypertension or coronary artery disease, those things need to be taken into account when you are thinking about the drug choices. And even in addition to the drug choices, we also need to think about the drug dose, because many of these patients tend to be on other drugs that can have drug interactions. They already, due to a variety of other comorbidities, may not be able to metabolize the drugs as well as the younger patients do. So some form of dose modification always need to be considered in the older patients. So it's very it's safer to actually start these patients on maybe a slightly lesser dose and then understand what their tolerance is before you actually go up on the doses. So these things have to be taken into consideration when you treat the older patient with myeloma.